chronically overweight. It's now thought that the true cost is billions more than previously thought, second only to smoking. Well, experts are calling this a huge wake-up call for Britain. So let's take a look at the figures. £47 billion. That's the huge amount that obesity is costing the UK. The study by the consultancy firm McKinsey & Company says its economic impact is second only to smoking, which cost £57 billion. And that puts it ahead of armed violence, war and terrorism, which together cost £43 billion. In fact, the figure suggests that Britain's obesity problem is costing an annual loss equivalent to 3% of GDP. So what can we do about it? Well, this report says a series of interventions would cut obesity by 20% within a decade. They include portion size limits on fast food, spending money on parental education and introducing healthier meals in schools and workplaces.
We eat too much sugar, too much saturated fat, too much salt and just too many calories. The average man is consuming 300 calories a day more than they need. And that leads to a big problem. So I think the sense of treats, we really need to think of those as not being an everyday thing. Having a fizzy drink and a bag of crisps every day is not good for our waistline.
But what's the solution to this expanding problem? Is the true cost to our health instead of to our pocket? And would it help if fatty and sugary foods, for example, were taxed more heavily? Well, I'm joined from central London by two people to talk more about just that. The coordinator of the Children's Food Campaign, Malcolm Clark, and the director of the TaxPayers Alliance, John O'Connell. Welcome to both of you. Malcolm Clark, first of all, would you agree that we need an overhaul of how we look at the problem of obesity? We need a whole new approach.
Well, absolutely, we welcome the report, and actually the important thing that it says is that we need to throw the book at tackling obesity and diet-related disease, throw the book and see what sticks. So it's many different measures that should include things like tackling junk food marketing and our obesogenic environment, but also measures which actually affect the price of these products and change our consumption habits as well, such as the sugary drinks duty.
Well, yes, tell us exactly what you mean by that. Do you mean that we should have a tax put on unhealthy foods, essentially? We should pay more for them?
Well, it's following the example of Mexico, of Berkeley, the city in the US, of Hungary and other countries which have introduced a sugary drinks duty that says that sugary drinks should have, let's say, in our recommendation, 20p per litre duty on them. And that's all the modelling, and actually what it shows, this is a practical solution that's targeted at sugary drinks, something that contributes the most added sugar to children and young people's diets, and actually this is something that is proven to work.
John O'Connell, what do you make of that? I mean, it sounds on the face of it like a sensible idea. It could encourage a healthier diet, couldn't it?
Well, another place that they've introduced a fat tax before was in Denmark, and they got rid of it after 15 months because it was just a spectacular failure. 80% of people in Denmark found it unpopular. They didn't really change their habits either. They carried on shopping for these kinds of foods. They went to Sweden, they went to Germany to buy them anyway, and it was taken away 15 months later. So we don't really need to make the case against this. It's happened, and it was repealed in Denmark. So I don't think that taxing and legislating is the way forward on this. We need to inform and educate, not tax and legislate.
And yet, John O'Connell, the cost to the UK, the figure that's come out, sorry, I'll come back to you in just a moment, Malcolm Clark. The cost to the UK is £47 billion in terms of annual economic activity. There could be some appeal, couldn't there, to the Treasury, that you would raise money and get the people who are perhaps putting some of that social cost, if you like, on the country to pay their way a little bit.
Well, no, look, again, as I said, it didn't work in Denmark. They got rid of it after 15 months. And, when we look at things like the cost to the NHS of obesity, yes, it's a problem. But, so is the cost of sports injuries to the NHS. What do? Ban sports? No, it's about informing and educating and making sure that children are active when they're younger, informed about the dangers of fatty and sugary foods and all the rest of it. And let's not forget, decades ago we were told that it was high fat content that was the problem. The market responded. There was low-fat foods and all the rest of it. Now the science is suggesting that it's sugar that's the problem, and hopefully the market now responds and starts, reducing the amount of sugar in food because of the demand. The demand will change from people. They'll stop wanting to buy such high sugar content in their food and drink, and the market will adapt accordingly.
Malcolm Clark, do you have faith that the market could adapt accordingly?
Well, no, absolutely not. I mean, the market at the moment spends, $10 million just in Berkeley and San Francisco alone to try and defeat measures such as sugary drinks duty. Whereas, in fact, in Mexico, which introduced a sugary drinks duty a year ago, consumption has reduced. It's a proven effective measure. And actually, the models here in the UK, in the northwest of England, say that if you introduce a sugary drinks duty, consumption will go down. We'll see £4 million of healthcare cost savings in the NHS every year. We'll see hundreds of fewer cases of diabetes, of heart disease. That is a good thing. And what we're talking about here is something that, it's a sugary drink. It has calories, but they're empty calories. There's no nutrition, and it's something that is actually a really significant problem in our diet. I think most people don't know the shocking statistic that the #1 cause of hospital admissions in this country for children aged 5 is dental health problems, dental caries. That's the sugar in our diet. We need to do something. We need to do something now. Sugary drinks duty, which you could put the money, the revenue raised, going into a children's health fund to do further interventions to improve our healthy food environment. That's the kind of thing that we need.
John O'Connell, you're from the TaxPayers Alliance, and you have to acknowledge that there is a huge financial element to this story, isn't there? So how would you suggest that we go about tackling this problem, which is proving so expensive to this country?
Again, as I said, of course, the report suggests that the costs are huge, but it's not about the state stepping in. We're going down a very dangerous road where we think the government and politicians have all of the answers to this. This is about informing and educating people. As Malcolm just said, a sugary drink probably doesn't have any nutritious value whatsoever, but we need to inform people about that. It's not just about saying you must pay more. We do that enough already. People are overtaxed, and do you know what? These taxes always hit the poorest hardest. Wealthy people will be able to carry on exactly as they are, but these taxes are regressive. They hit the poorest hardest, and they are the ones who are going to suffer.
That's because it's the poorest who are affected most by poor diets. That's what we're trying to change. Actually, something like this kind of intervention is fair.
That's about education. That's about informing people and telling children at school, teaching them how to cook. It's about all of these things that we don't seem to do anymore.
It's about the number of takeaway shops you'll see in poorer areas. There are hundreds of different measures as to say actually why people our most vulnerable people in our society actually are most affected. Poorer people have this issue that in fact for all of us it matters, because healthier food should be more affordable to us, more easily accessible.
I completely agree with that. I completely agree with that. And we have lots of regulations coming from Europe, like the Common Agricultural Policy, which makes healthy food more expensive. We definitely need to get rid of regulations, not add more, to make healthy food more affordable for people on the lowest income.
Something we agree on was actually it would be changing the Common Agricultural Policy and this thing of subsidies for sugar, which is ridiculous and something that really needs to change. Yes, I'd agree on that.
OK, well, at that brief moment of agreement, let's leave it, shall we? Malcolm Clark and John O'Connell, really interesting to talk to you. Thanks very much indeed. Let's just bring you a quick bit of breaking news that's coming into us via the Reuters news agency. They're reporting that